Welcome to Rough Realities and Revelations.
Our podcast.
I know, how exciting. How are you?
I'm all right. How are you?
I'm okay. I'm not bad. Not bad. What's the day you had?
You know, it's been a day.
Been a day?
Yeah. I can't believe we're so far through the year already.
I know, it's quite scary. I'm quite sad that light is diminishing.
I know.
What is it, September now?
Well, yeah, the bear months. They're my favourite months.
The bear?
The bear months. September, October, November, December.
Okay.
The best month. Because you've got pumpkin spice season. Spooky season.
Spooky season. 100% within spooky season. I've already bought some mugs for spooky season. Mugs, yeah. Because I don't need any more Halloween mugs, but I saw these ones and I was like, oh, I need you in my life.
Excellent, excellent. And then, of course, my favourite festive season is coming up.
Nah.
But September.
We're not going to mention
Christmas.
Boo and we've got Bah Humbug over here and we've got Mrs. Claus over there. Yeah. I will just stay forever in my spooky season.
I just like to get spooky season out the way so we can start the festive season.
Do we? And I just live for spooky season all year round.
Yeah, but anyway, that's not what this podcast is about.
It's not actually, no, is it? It's not, because it is September.
It's September and it's International Pain Awareness Month. So that is to raise awareness about pain management, and the amazing people that work in the field of pain management.
Yeah.
Originally a human celebration's not the right word, but marking of pain. It's been taken over by the animal community.
Which the reason I'm quite excited, because it's not nice to think of any living thing in pain. That sucks. But the reason I'm like, oh, we're shining the spotlight. Because as a trainer, I deal with so many dogs whose behaviour is actually driven by the amount of pain and discomfort that they're in.
Yeah, same.
And I just want to educate people. I just want to educate people to help get these dogs out of pain and get them more comfortable. So that's the only reason I'm excited, because I've realised that sounds a bit weird to me going, oh, pain away. I mean, I know I'm into Halloween and everything, but...
No, that's Friday podcast.
It's not. No, it is not. So, I am quite excited about it.
I think on that note, I'll just mention I'm drinking coffee just in case there's slurping on the Spotify. It's just me drinking coffee.
No pumpkin spice?
Mm-mm.
Oh, dear, oh dear. Have you pumpkin spiced yourself out already?
Not yet.
But no, I think it is good to put that spotlight on and raise that awareness and everything.
Definitely. So, there's lots of different types of pain that our dogs might be in. Joint pain.
Yeah.
Tummy pain.
Funny enough, I've got 2, maybe 3, because I've got oldies now.
Yeah.
That and that. Possibly 1 that has tummy pain.
Tummy pain. Yeah.
So we've got joint pain, tummy pain.
Ear pain is another big one.
Funny. So my allergy boys, this is Eric. So Eric, my Border Terrier, I love him a bit, but he's a bit broken. This is why I won't go pedigrees again. I'll just get my little crosses. But he does suffer a lot of allergies, and I know when his ears get an infection, he's sad.
Yeah. Makes
him sad. When they're like that. Yeah. So we've got ear pain.
Ear pain, and then another big one is dental pain.
Yeah. I had toothache for the first time in my life about 3 or 4 years ago. That was horrendous. So I can only imagine, if their teeth are a bit...
Yeah, I think it's something like 75% of dogs over the age of 2 have some kind of dental disease. So it starts to happen quite young.
And I think is it not as well a bit determined by breed? Because George, my little pug cross, pugs notoriously have terrible teeth. And we got him, so he was a little rescue dog. So we got him out. He was about 8 or 9 months old. But he still had all his puppy teeth at the front of his mouth. I know, so they were like a row of condemned hises, because he had, the adult teeth were there, but then pushing forward were still little puppy teeth. So he almost had doublers. So the rescue got those removed before we could take him home, but that left with really shoddy adult teeth, because they'd been pushed out the way. And when he hit 7, those front teeth did become wobbly when they hadn't been wobbly before. And we had to take him to the vet because it like must have been rank. Like, I'm sure there were all sorts of bacteria in there as well. But he did 19 out in the end.
Oh, boy.
I know, little gummy bear that he is.
How many teeth do dogs have?
Is it 42? 42, 47?
I don't know, it's more than humans, isn't it?
That is definitely more than humans. So basically, he had half his teeth removed.
Wow.
I know. But it doesn't stop him.
Yeah.
Still chooses choose. Unless it just, gums him. So yeah. So
yeah.
There's quite a lot of different ways.
Yeah, definitely. And I think it might be worth as well just quickly speaking about the difference between acute pain and chronic pain as well.
Yes. I think it is very, because I see it as an important thing because of when dealing with dogs' behaviour, whether you're dealing with acute, I was going to join the two words together there.
Chronic pain. Yeah. So with acute pain, there's always there's a point to acute pain. There's a reason for acute pain. So you've banged your funny bone or stubbed your toe or twisted your ankle, and that pain is there for a reason to remind you that you've done that you've damaged that area.
So don't do it again.
Don't do it again.
But be careful.
Rest it until this pain goes away, and ultimately that pain goes away. But with chronic pain, there's no point to chronic pain. It's just there. It's there all the time.
You're talking about my back and my knees.
Yeah.
It's just this throb. Yeah, because the way I always think of acute and chronic, acute is sudden, and it's just happened effectively. Chronic, it's been going on a really long time, and that wears you down. So
definitely,
anyone listening that's got arthritis, for example, you know how much that wears you down. Yeah, because it's just there.
The trouble with chronic pain, though, and what makes it difficult for people to realise that their pet might have chronic pain, is that it does wax and wane. It comes and goes. You have good days, you have bad days, you have good weeks.
Yep.
Where you might be feeling okay. And so that can make it tricky for people to realise that their dog is actually in pain. So what might be some of the behaviour things that we might be seeing if our dog was in pain?
I think if I get people coming to me, excuse me, and they're saying things like, my dog has, and for me, the main red flags in this is they suddenly started. So if they contact and they say it's a new behaviour. So they starting to vocalise more. So this could be when they hear noises. So sound sensitivity is massively linked to pain. There's now so much more evidence pointing that when we have dogs who are sensitive to noises, the chances are there's some level of pain or discomfort happening for that dog. Yeah. So this could be, they hear delivery vans, they hear things in the garden, or when people knock the door. And we're not just talking about alert barking, like a couple of woofs, like somebody's there, and then they're like, clean them off and they'll go away. This will go on and on and on, and the dog can't bring themselves back down from it. Can start to become more vocal around other dogs. So they'll be barking when they see other dogs, or excuse me, if other dogs are coming over to say hello, they're maybe barking at them to stay away, or you're going to see slightly more grumpy behaviours from them. They might snap at the other dog if the other dog goes to sniff them for too long, or if the other dog's quite bouncy, that dog will start barking and snapping at them to go away, and the owner will just be thinking, oh, my dog's behaving badly. I'm going to ask a trainer to come and help me, which is a good idea. Like, they should be asking instead of just Googling stuff. But that's a flag for me. If they are saying things like, as we get talking, they might say their dog never settles. Yeah. and is pacing all the time. They'll lie down for a few minutes and they get up and they start pacing and things. Then I'm like, there's another flag. There's other ones where maybe the dog isn't actually jumping on furniture as well as they did, or I've had people come to me and they've said they refuse to get in the car. They're just refusing. I don't know what's happened with the car, but they won't jump in it, as if like it's a slur on them that their dog will not jump up. And I'm like, well, that's just news. The dog, hurt themselves or something. Dogs who guard items, that is often, they will have tummy problems. I'm finding this out. The more I kind of delve into dogs with resource guarding problems and things like their diet and, stuff like that. Because if your dog has intolerances to certain foods, funnily enough, this shows up as ear infections and, itchy skin and stuff like that. So these dogs are already feeling uncomfortable and then they can kind of tend to guard things more.
Yeah.
So if I'm getting flags like this, my brain's going to start going, I think your dog's in some level of discomfort there. I think there could be something medically up with them, which is not my realm.
Yeah.
That's, I can't help too much with that, but my experience has taught me that these are all red flags. And it can also be simple things like the dog's not as playful anymore, which I think is a hard one to spot, because like you're saying, with chronic conditions, these things wax and wane. I think about Eric a lot, because he's got hip dysplasia, but we didn't find that out until he was 7.
Yeah.
And he's always done agility. I've kept him pretty fit. He would stay physio on a regular basis. Loves his agility. Relatively active on walks, so he could have wee bursts of speed playing with everybody. And then he would just wander around. And we've always joked that when he hit a year, he just turned into this old man. It was almost like I'd done far too much socialising and partying with him as a puppy. And he's like Mr. Cool. He's like, seen it all now. I don't need to get excited about life. I've been there. And he very much, looking back, I'm now realising he did wax and wane. He went through spurts where he was like totally up for everything, and then he would sort of lie around a lot more. He would sleep a lot more. He'd be quite slow on his morning walks. But bless him, if we were doing agility, he was always up for that. And he was always wanting to do things. And actually, it was only through doing agility that we noticed that he could be in pain. Because there was one day he didn't want to do one of the pieces of equipment. And that's totally weird for him. Because he does genuinely love it. And my instructor and I looked at each other and were like, that's odd. I was like, I think I'll book him in. I'll get him checked. So off to the physio and everything he went and stuff, and everything snowballed from there. And we found out, well, actually, mate, you've got a genuine reason this is now sore. This is it's stopping you doing the things that you want to do. But in his everyday life, he didn't show any of those red flags that I've just listed. He's not a barker. He's not reactive. He has a bit of a guarder towards the other dogs in the household, but not to people. That never changes.
I think it all boils down to knowing your dog and what's normal for your dog. And a lot of the signs as well can be quite subtle. So changes in body shape, for example, can be an indicator that your dog has joint issues. For example, if they get skinny at the back end and a bit bulkier at the front, that could be an indication that there's...
That's like when you see those guys at the gym
that forgot to do leg day.
Basically, They totally walk up in the shoulder and they got these chicken legs. Little chicken legs. So,
So in our dog, that can indicate that the front half of the body is compensating for a lack in the back half. And what you're seeing there is like starting to lose muscle tone and things like that. So changes in body shape is one.
I've just thought of one.
Have you?
I was like, let me tell you before I forget it.
Right, tell me.
Memory of a sieve. Coat changes.
Coat changes, absolutely.
My boy Riley, he's got quite a I would say a mid-length coat. It's not long, but it's very thick.
Is it middle length?
Yes, I don't know. I mean, that's probably like a horrendous.
It's not long, it's not short.
Yeah, exactly. It's just a mid-length. And it's got, but it's straight. And all of a sudden, over his shoulder area, he went wavy.
Wavy.
And I was like,
yeah, that's really
oh,
cool.
son, what's this? We've got like starting a wee 80s perm there going on. What's happening? And so we went and visited our physio, and it was really tight muscles across the shoulders. So he would go for his massages and I would do stuff. And then over the coming weeks, it's gone straight again. And it hasn't gone curly again.
Yeah.
So yes, coat changes.
Another thing I like to ask people is, when was the last time your dog had a big stretch? You know, ooh, big stretch.
I was going to say, my dogs do big stretches, because every day I'm like, ooh, big stretch.
Big stretch. So what you start to see if they're stiffening up is that they don't stretch as much, or they don't stretch as deeply as they used to before.
It's an interesting one.
So that's...
Actually, that makes total sense, because as you're seizing up, you can't, there's things I can't do that I used to be able to do.
Your stretch gets smaller and smaller. So that's another thing to keep an eye on. Is
just thinking leg day doing lunges. It's not much of a lunge anymore. Can't do it.
And then you mentioned playing, but you know, are they getting their toys out as much, and you know, things like that? That was a big signal for cousin Leo and how he was feeling, was whether or not he got his toys out, and which toys did he get out. You know, he had toys that he only got out when he was feeling really good. Yeah,
it's like, oh, I'm going to play with it.
Yeah, but again, that's like knowing your individual dog.
Well, and I think as well, my two phrases have popped into my head that I always feel are some sort of rebuttal when I start to mention this, because quite frankly, nobody wants to think of their dog as being in pain and not realising it. Absolutely. So I think there's like the two things go on there, like, oh my God, how could I not notice my dog's in pain? And then you feel horrible, which, do you know what, at the end of the day, they're a completely different species. They're designed to hide things. They don't, it isn't obvious. So, you know, nobody should feel guilty for, I mean, geez, there's me, Eric, with his dodgy hips for basically his whole life. Yeah. And I'm gaily taking him and doing agility and, you know, all this kind of jazz. So, you can, you know, beat yourself up all you want, but it's not, no, I don't think anyone should feel bad for like not noticing. No. But at the same time, we also don't want to think of them in pain, because we're like, oh no, that's horrible, because we don't like it when we're in pain, and it's sad. So I'm usually met with a few rebuttals. One being, they're just getting old, Danny. Yeah. Like that, as if we should just accept pain and age go hand in hand. Yeah. And I think for something as subtle as toys, you would naturally start to assume, as your dog ages, we don't pull out like, I don't know about you, but I don't pull out Lego anymore. I'm playing with Lego. I mean, kind of past all that. I've switched to like adult games, but you know, oh sorry, Lego.
It's not that kind of podcast.
But you know, there is an inclination that as the dog gets older, they would naturally dwindle at pulling out toys. So you would be quite justified in saying, well, they're getting older, why would they pull out their toys? Yeah. The other one that's linked with toys, which is my like soapbox, like stand. One of your one soapboxes. Yeah, exactly. Yeah. They still chase their ball. It's all like that. Just yeah.
You know, when I say to people, I've got arthritis in my knee. Yep. I'm still here at my work doing my job.
Yeah, because you do love your job, even though it's sore on your knee.
Well, yeah, I love my job, but I love the outcome of my job. Yeah. Which is the money. So, you know, so the reward.
The motivator.
Yeah. The reward for pushing through that pain is worth it.
Yeah, and I think when it's...
that's the same with the ball.
Well, right? It is, because the dog, that has become a habit, and that has become, the dog has paired up. I enjoy, and when we're talking about this, I will always add in, I'm not talking about you sensible people that throw the ball like once on a walk and then play hide and seek with it the rest of the time. Or you use a ball and a rope and you play tug. I'm not talking about you people. I am talking about the people who exit their car They haven't even left the frigging car park.
Yeah.
And they've taken the ball launcher and they've thrown it towards the open area for the dog. So the dog's had no warm up, no nothing. And it's just running and getting the ball. Or those people who stand in the corner of the green space and literally just throw a ball back and forth. These are the ones that I'm like,
yeah, definitely.
About. But the dog that is for the dog, you have just got them so used, you've built up an expectation that I'm going to go chasing my ball.
Yeah.
But also, when you are doing physical activities like that, your body is releasing pain-producing endorphins.
Mm-hmm.
So the dog at the time doesn't feel like that.
I think as well, from what we know about dogs, they're not thinking, oh, I better chill out here a bit because I'll be struggling to get on the bed later.
No.
I better take it easy because I've got to go on another walk tomorrow.
Yeah.
You know, as far as we're aware, dogs are not forward thinking like that in the same way that we would be.
No, they don't. But that's what I love about them. Actually, they truly just live in the now.
Mm-hmm.
They don't get stuck in headspace about, you know, past, present, and future nonsense. They're like, this is the now. This is all I'm dealing with. So yeah, you're right. They don't have the foresight to go, I'm going to regret this.
Yeah, because I know sometimes, like at fitness classes, I'll be like, right, I'm going to go down a weight tonight because, you know, I need my arms to work tomorrow at work.
Yeah.
You know, dogs just not thinking like that.
No, so of course they're just going to chase it. So that, your dog still chasing a ball, your dog still jumping up on things, isn't actually a sort of let's null and void, my dog must be, you know, can't be in pain kind of thing. You can't, that's not enough. It's like, how many attempts does your dog take to jump up?
Mm-hmm.
You know, are they hesitating? Are they doing that funny little shimmy before, and then they do that crouch and they're like, oh, not this time, I'll get my springy legs in a second. And then, you know, they'll lunge. So there's all these things to look for. And I think in some ways, the gut one is a trickier one to spot and to navigate. I think it's obvious. Well, it's not. Sorry, I should say it's obvious to you and I, who watch and we sort of seem to spend our lives going, "Oh my God, this dog seems to be in pain."
Mm-hmm.
But I think it's, you know, people can then, once I start pointing out the flags or maybe asking certain questions, people will say to me, "Do you know, now that you're saying that, they don't always get up on the couch anymore.
Yeah.
I've noticed they lie on their bed a bit more." Or, Ken, see, in the morning they used to pester me to play. They used to bring their toys out in the garden. They don't do that now.
Mm-hmm.
And it's not until and I'm the same, it's not until you point something out to me that I go, well, actually, that's a good point. So, but tummy issues, I think, to be honest, unless the dog has diarrhea constantly, or more often than not, I don't think anybody would register that could be a tummy problem because it's not as obvious. It's, the dog can't say to you, by the way, my stomach's cramping, or by the way, I've got acid reflux and I don't feel particularly good. So for me, if people are saying my dog's not that interested in food, so like when they talk about, oh, when we're out, I try and take food, but they're not interested. Obviously, I will look at, is the dog stressed, over aroused, you know, that kind of thing, but that's another chat. But then if they're telling me the dog's quite picky at home, doesn't really eat, doesn't have set times for eating, likes one type of food for a little while, then all of a sudden will never eat it again, and stuff like that, I can't help but think, does your dog feel ill when it eats?
Definitely.
And does it get sore?
But,
And
you know, that can also be an indication of joint pain as well. And because one of the things we have to think about, with our, you know, our older dogs or dogs that have arthritis is how we are feeding them and the position of that bowl and what we're asking the dog to do in order to get the food. And sometimes it's just too much. It's too much to put our head away down to get to the bowl.
Really
to be standing on a really slippy floor to eat the food for the, you know, the few minutes to eat the food.
Yeah.
And imagine how rubbish that would be. You know, you really want to eat, but it's just too uncomfortable to get to your food.
I would be so sad.
That would be so sad.
Like my food.
That would be so sad. Right, so we've gone through the signs and we've accepted that our dog might be in pain, right?
Right, yeah. So
we've ruled out, things like dental pain because their teeth are sparkling, no ear infections. We don't think it's tummy related. So let's, think about chronic pain like joint disease, like arthritis, for example.
Yeah.
So now we have to go to the vet and explain to the vet why we think there's an issue.
The reason I go, oh, and I must admit, right, so I'm gonna fair play say I do love vets. I have quite a lot of friends that are vets.
Yeah, no vet bashing here.
There is no vet bashing. But and fabulous job. But I have to admit, a lot of what I hear, so that, people that I have suggested, like, I think you need to go to the vet because as a trainer, medical stuff, not my bag. It's not my wheelhouse. We're not entering that. But they are met with, when they explain the red flags that have caught my attention, they are met with, but that sounds like a behaviour problem. It doesn't seem to have filtered through vets, the medical world, as much as it has the training world, the connection between a dog's behaviour and a dog's pain level.
Yeah.
They don't seem to marry, and I feel so frustrated when the owners will come back to me and they'll go, well, we went, but we were told to go see a behaviourist, or we were told we must be letting the dog away with things, and that we should tell the dog off if they bark too much, or we should do this, and that's kind of why I went go to the vet.
I mean, I think for me as a groomer, it's a bit easier because what I'm saying is, your dog's got crunchy knees, or your dog's suddenly anxious about having this leg lifted. So that's the information that's going to the vet, and that seems more kind of solid, almost something that
more
the vet can.
I think
if yours is
more woo-woo.
I think the behaviour stuff is because it's not like a solid thing.
Yeah, because it could be a million things. It genuinely could be because the dog has hit a development. No.
Developmental.
Thank you.
You're welcome.
I was going to get stuck there, but but they could have hit a stage, right? Yeah. And actually, yes, it is behavioural.
Yeah.
But us dog trainers, we do, if we're good at our jobs, we get to the roots of why the dog is behaving the way it's behaving. So if its behaviour has been influenced by pain, if we don't address that pain, we can't address the behaviour. But equally, if you leave the behaviour, I must admit, sometimes you will treat the pain side of things, but the behaviour has become a habit.
Yeah.
And it's very hard for the dog to change. So you do need both in that instance. But owners have gone to the vet, because I was slightly going off on a tangent there.
You were. Was there not a study that looked at
the Mills study
cases to behaviourists?
Yes.
And the percentage of them that turned out to be pain related
was just phenomenal. They had, if I remember rightly, it was different vet practices, and it was dogs who had been referred to the vet behaviourist for behavioural problems. Yeah. And being a vet behaviourist,
so that's like a clinical behaviourist.
That's proper.
A vet who is also studied and trained to be a behaviourist.
Yes.
And they can
diagnose stuff.
And they can prescribe behavioural medications as well. Yeah.
Yep. Stuff I can't do as a trainer. Legally can't do anything.
Yeah, and also people who just call themselves behaviourists. They
pretty much, they cannot do that.
Name.
Yeah, no, exactly. Yep. Still to this day is why I use the word trainer, not behaviourist, but I do know. Yeah. I understand some of it, but
so they're often called vet behaviourists and often called clinical behaviourists.
Because they've done a lot of studying and all.
Absolutely.
They've got big brains. So what they found was, depending, because you were looking at various practices, when they got down to the nitty gritty, in some practices, the dogs that had been referred 80% of those dogs had a genuine clinical pain-related condition that was causing their behaviour. And which is 80% of them.
Yeah.
And then I think the lowest one was still at like 50%. I mean, we're not, we're not talking as little as 5% of those dogs. It was the majority of those dogs that came had a legitimate medical reason that was driving the behaviour that needed to be addressed to help the dog, be more comfortable.
Well, mind we looked recently at my behaviour referrals for grooming, and of the most recent 20, we counted that 14 of them.
Yeah.
It was pain related.
Yeah.
That had caused their behaviour, that had led to them, biting their groomer or whatever they had done.
I know, and I just find all this thing fascinating. And I think making sure if you suspect your dog is in pain, now whether this is because you are observant and you have educated yourself on this and you're like, actually, do you know what? I don't think my dog is being a dickhead.
Yeah.
I think my dog could be sore. I don't think my dog's being stubborn about doing the things that I asked. I think there could be something wrong with them. Or whether this is you've contacted a trainer who's went, oh, red flag city for your dog.
Yeah.
We suggest you go visit the vet. I do feel you need to make sure you know what to say.
Yeah.
And not to be, just told, well, here's the details for a certified behaviourist. Contact them and be on the waiting list. There's steps that you can do. Do you know what I mean? For it.
Yeah.
So, do you want to know the steps? Or I bet you do know the steps.
Tell me the steps.
The steps that I go through is I think if we're thinking that the dog has a joint problem, I would be videoing my dog walking normal, like how they would normally. They might not be walking normally, so it's how your dog walks when they're out and about with you, because we all know that you can take a dog who is holding its foot up, can't put its foot down.
Yeah.
It's like a wee tripod hopping along. As soon as you get to the vets, walks perfectly fine.
Yeah.
And you're like, really?
Miraculous.
Like, I know. It's amazing.
Yeah.
And then we all know the ones that just completely shut down at vets and just stand there. Like, no, I'm not going to move. You can't make me do anything. Like, I remember my Basset, you could never feel what was going on because he would just go like a rock. So you had no idea. You could not tell what's happening with him. So I think it's super helpful if you have a dog who could do any of those behaviours, get yourself video evidence before you go. So, just take your phone out on a walk, film your dog walking along so your vet can see how they move naturally. Yeah. So that they can go, oh, that's a bit of a jaunty walk they have. Or, they can say, oh, I can see that's a bit stiff or whatever. Because I think in the vet practice, if they're just being physically manipulated, Eric was physically manipulated loads. Yeah. And quite a few people told me, Becky, he's fine. Like, he can move all around. And it wasn't until we got x-rays that we all went, oh, he's got really bad arthritis. And that's what's been causing him most of the pain is the arthritic growth on those joints. But for all intents and purposes, he moves fine. Yeah. But it wasn't until x-rays that we knew. So make sure you've got some form of evidence.
You can ask the vet to come outside and look at your dog. And a good vet would do that. A pain specialist would want to see your dog moving naturally. They would come out to the car park, they would get you to walk up and down and see, with their own eyes what's going on. Yeah. But because we mentioned, for example, arthritis waxes and wanes, the day you get the vet appointment might be a good day.
I know, I was going to say it's sod's law, isn't it? Your dog will be like, I'm absolutely fine. Take them tomorrow and they're just walking like they're about 100 years old.
Yeah. So I think it's good then to maybe keep some kind of diary. And there's lots of tools on the Canine Arthritis Management website.
Which we'll put a link into the show notes.
Put a link.
Yep.
The osteoarthritis booklet is a really good one.
Yeah.
And it has space for you to record, good days, bad days, what that looks like for your pet.
And I think on that note, it's not only good to allow a professional to see that. I think it's actually good for you to see that. to then be more aware of, are the good days, are there more good days than bad days, or are the bad days starting to outweigh the good days, and things like that as well.
Definitely. I think though it's maybe worth pointing out that we're not just talking about old dogs when we're talking about arthritis.
Oh no, we're talking dogs that are like 1-2 years old.
Yeah. So I mean, it does affect 80% of dogs over the age of 8, but it affects 35% of dogs of all ages. It's a young dog's disease, and we're just not recognising it until the joint itself is end stage and it becomes problematic for the dog.
Yeah.
It's likely that when that dog is diagnosed with arthritis, they've had it for a number of years prior to that.
No, it's hard.
So don't tune out because you think we're just talking about old dogs.
Yeah.
We're not just talking about
this honestly can be any age of dog. And sadly, I've seen dogs come to classes and as little puppies and been wonderful. And to be honest, by a year old, they're needing operations for hips or elbows or so. Yeah, this is like any age. But I think if you can go armed with a bit of video footage, that's helpful. Go armed with a diary, that is helpful. You also can ask for a pain trial. Like, you don't have to have a behaviourist tell you to go on a pain, because no offence, a behaviourist, that is exactly what they're going to tell you to do.
Yeah.
And a pain trial is where the vet, and it's only the vet that can prescribe this. We can't, you can't go ordering online and all this sort of jazz, or nip into your mate and asking for some pain relief. It has to be the vet that does this. But you can ask to be given pain relief, and effectively what you're trying to do is see, does it help or not? So personally, I would ask for minimum 4-week trial, but preferably 12.
Yeah.
Because then we're looking at the difference between acute and chronic. So Eric was given, so when he first showed that issue at agility, we put him onto pain relief and everything, because we noted when he went to the physio, there was a little bit of muscle wastage in one of his legs, which indicated he wasn't using that as well. So decided to try pop him on a pain trial, because obviously something was making him uncomfortable.
Yeah.
And so he was on anti-inflammatories, is normally the kind of go-to, given what I had described and the fact we'd felt muscle loss. The vets felt that was the better course of action.
Definitely. I mean, it's relatively safe. It's been on the market for about 35 years.
Yeah.
There was a small survey of, I think, about 200 vets asking would they put their own dog on an anti-inflammatory if they thought they needed it, and all of them came back and said they would. I
think these myths about the anti-inflammatories, I think people, I was that person that was like, it'll start to ruin their kidneys, I regret, there was one of my previous dogs, I held off doing that because I honestly thought I was going to kill his kidneys and I'd kill him sooner. And now that I think about it, I think, you stupid woman, you bought into those myths, you didn't look into the science. You just went, oh, that's what everybody's dead. And actually, I could have given him a few more months in comfort, rather than, at the age he was, having his kidneys go was the least of his worries. Do you know what I mean? His kidneys could have functioned all right on that, but his age was kind of going to get him before anything else, if you know what I mean. So I think, that's just, all of that, you don't have to worry about. I think if it's going to make your dog comfortable, and everything. But Eric I didn't notice a difference in his behaviour for 3.5 weeks.
Right.
When we put him on it, because I was beginning to wonder, because we hadn't quite done the x-rays by this point, so I didn't know. So I was a bit like, I don't think this is helping, because he was behaving the same. However, around about the 3.5 weeks, because I did keep a diary, because this is what you want to do when you're trying on a pain trial, you are keeping a diary. What we noticed was, in the morning, he's always been slow.
Yeah.
So generally he walks right behind you, but the lead tends to be a bit taut because the other dogs are walking faster, so his lead would be tight. What we were then noticing was his lead was loose and he was right beside us, which indicated he was walking faster. which meant he must have been feeling better. But that took 3.5 weeks for that to kick in.
Yeah, that's interesting.
And it makes sense because he's had chronic pain because he's always had bad hips.
Mm-hmm.
It's not been acute. So I think this is why I would ask for something that's minimum 4 weeks, if not longer. And I think that's always the thing to, when you're keeping a diary. So if the vet agrees and goes, yes, I think a pain trial would give us some information, and because let's not kid ourselves, it's also the cheapest way to find out, is your dog actually in pain or not? Because you're not going straight to x-rays, you're not going to blood tests, you're not, CT scans, everything, we're not millionaires. We can't afford all of that nonsense. Yeah. So, when you're doing that, if, for example, you just got 2 weeks worth, I could have, if I only got 2 weeks worth for Eric, I, hand on heart, would have said, no, he's not in pain. Because it didn't change anything, he didn't get better, he stayed the same. So I would have went, it's absolutely fine. But actually, that's not true. It wasn't long, 2 weeks wouldn't have been long enough to see results for him. Yeah. But then also, anti-inflammatories, I was going to say anti-steroids, that's not right. Anti-inflammatories might not have worked for another dog with another condition. You could have needed a different type of pain relief. So then so I think it's being aware that if there's no improvement, it doesn't mean a flat out, no, your dog is not in pain. Yeah. It means I would also look at the length of time you've had it on them. Is there another type of pain relief we can try to see if it's this? And then if everything still stays the same after that, then you can then hold your hands up and go, okay, it's kind of looking like, no, this isn't a pain thing. Mm-hmm. Me being the saddle I would definitely be getting x-rays though. Yeah. Because I've had too many of my pets where it's been nothing's wrong with them, and then we've done x-rays and it's like, oh, yes.
I mean, that is the gold standard for diagnosing. And sometimes vets won't, push for x-rays because it's, it's really obvious that the dog is in pain and the pain trial has worked. But that is the gold standard. But, assuming then that, that the drugs have made a difference, everybody's accepted that this dog has chronic pain, has a joint issue, you've done x-rays or whatever, it can be quite scary then to think, oh, is my dog going to be on, my dog's only 4, like, is it going to be on medication for the rest of its life? But actually that's not necessarily the case. And, canine arthritis management, they promote a multimodal approach to managing chronic pain. Mm-hmm. And it might be that your dog has to be on pain meds for a short while, whilst you get other things in place. So some of those things might be a big one is addressing any weight issues that your dog might have. And I think it's 65% of dogs in the UK are overweight. Yeah. So I don't know if you're familiar with the body score index, which is the poster they have on the wall at the vet. Yes, I like with that one. The skinny dog through to the really obese dog. Yeah. And in the middle is number 5, and that's kind of your perfect weight dog. But really with a dog that has joint pain, you want to be between 4 and 5. About 4.5 would be the ideal.
The sad thing is, I think I keep my dogs about a 4 because I'm so conscious because, less, I'm what would I be on the scale? I'd be a 6, 7? I can't remember the numbers.
Don't know if there's a scale that goes that high. It goes up to 9.
Oh, okay. Right, I'll go a 7. I'll go a 7. That sounds a lot. 6. I'm carrying too much, put it that way. I know how sore I am with that, and I just don't have the willpower to do anything about it. But I have the willpower to make sure my dogs are not in the same predicament as me. So I think I personally keep my dogs about 4. And actually, that was commented on Eric being okay until the age of 7, was the fact I keep him so lean, as he didn't have that extra weight, like making life more difficult for him. So yeah, you're totally right.
Yeah.
Get them to lose weight.
The adipose tissue that fat is inflammatory. And so that's going to be making any joint issues worse, as well as the fact that you're just physically carrying around like,
Harder
you
to
know,
run,
I'm probably carrying around like a 5-year-old child all the time, like with how overweight I am. So that's, you know, obviously going to have an effect on your joints and everything like that. But yeah, you're looking to keep your dog maybe around 4.5 out of 9 on that body score.
Oh, okay, right.
But they've said that even so, if your dog is overweight, so if your dog was a 6, for example, on the body score index, that would suggest that they were 10% overweight. So they've said that even a 6% weight loss can make a difference to joint pain.
Oh, that's good.
So it's really worth.
Yeah. So trying to drop that weight on them.
Yeah. So that's one of the things that you can do. And then looking at additional therapies as well. So for example, physiotherapy.
Yep.
Hydrotherapy.
Yep. Well, we haven't tried hydrotherapy, but Malloc was physiotherapy. And some of one of my other guy, my cat's Morag, she goes for acupuncture.
Definitely.
She loves her acupuncture in her little body.
Yeah. I mean, I'm not entirely clear on how acupuncture
I don't understand it, but I just know she feels really good.
Yeah.
Like when she has it, and see for a good few days afterwards, she's so much happier and content. And she's an old lady. She's like 16 and a half.
Yeah.
So she's going to have.
It just makes you care less about stuff. Feeling quite nice.
Yeah.
Like cousin Leo was not a good responder to acupuncture. It didn't do anything for him. We persisted with it for a while, but it didn't add anything to his.
He was just a bit like the sister spirit.
Yeah.
Like why?
Whereas, you know, hydrotherapy, for example, you know, you could physically see the difference that was making to him in terms of like his muscle tone and stuff like that, which made it easier for him to support those kind of dodgy joints, you know, because the muscle around it was more toned and better.
Yeah. Oh, that's good.
Yeah.
So we've got
we're putting these things in place. Yep, definitely.
We've got
additional therapies.
Yep.
We've also got exercise modification, which is a really important thing. And, you know, that can be difficult to digest as well if you're used to taking your dog to agility or going hiking with your dog. I did
feel sad
that
he wasn't coming with me. He comes to the shows, so he still partakes. So he comes out with Bertha. And you know, and he loves his camper van life. Yeah. But it does make me sad that we don't go to training together anymore. And it was a bit like, this is if I had more time, I would absolutely swap on to hoopers. So that would have been our change if I wasn't as busy. Yeah. Absolutely would have changed. Yeah.
But even if you're used to just going on a long walk,
just shortening them.
You know, shortening them, that can be quite devastating to some people that you're not doing that anymore.
Yeah.
But yeah, exercise modification, thinking about
the chariot that's popped in my head as well. You can, so because the thing is, going out walking with your dog is a massive thing, and spending time with your friends is a massive thing.
Getting fresh air is a massive thing.
Absolutely.
For our own emotional well-being.
And I have to admit, I mean, I call them chariots, but they're essentially the dog buggies. Yeah. I think having these around has been a game changer for young puppies to be socialised, but also for dogs that have physical limitations, whether it is because of joint issues, age, whatever. The amount of dogs I've seen so happy that they still get to go out and about in their buggy. So you could still do your long walks, but some of it might be with, I just like to call them chariots. Some of them could be with a chariot, though. Yeah. So the dog still gets to walk and do its thing. Yeah. But then you can put them in their chariot and you can still go on the walk with them. Yeah. So,
I mean, I think one of the things that you have to think about when you're thinking about exercise modification is, you know, what that walk is going to look like and how much energy that dog is going to have to exert to get to the good bit of the walk. If you think about some of the places that we walk, for example, you know, some of the beaches, you have to walk quite far from where you park to actually get to the good bit of the walk.
Yes.
And so if you have something like a stroller or a chariot, you know, you can use that for the kind of boring bit of the walk.
Yeah, because I must admit, there are places that I go that I do think that, you know, maybe I go with the classes opposed to, you know, take lanes as much. I do think, as my dog's age, I can't get them to this bit. I can't have a million chariots at once. Like, I'm not going to have 7 chariots at once. That'll be far too difficult to control.
Yeah.
But yeah, I would definitely look at, you know, examples like that. So yeah, so we've got, so,
so exercise modification.
Yep.
But thinking about where you're walking them as well. So if your dog's got arthritic toes, let's not take them to a pebbly beach.
No, that's not nice. Or a long, gritty, like, cycle. Like, if it's, I see a lot of paths, and it's just stones. I don't know what the technical, I don't know what they call those type of paths. But yeah, the dogs do not enjoy that. Mm-hmm. So stick to smooth surfaces for them.
And then be reflective on your walk as well and think, right, actually, 10 minutes ago my dog was starting to look a wee bit tired. Mm-hmm. So pay attention to what's happening, see how they are after the walk, and think, right, what am I needing to change there to make sure that it's not ending on a low with my dog feeling tired and uncomfortable.
Yeah. No, I think that's important, because then it's not for the dog, it's not as nice an experience, because for the dog, they think that was just too much.
Yeah.
That was just too much. And when you then want to take them out again, that's when you can start to see, for some dogs, hesitations, because they go, I really want to go with you, but actually it's going to be too far and I'm just going to get too sore, and I don't, I'm like, I don't want to do it. So so yes, changing your exercise will help.
And then another big thing is modifications in the house, and remembering that it's their house as well.
Yep.
So a massive one is thinking about your flooring.
Yeah.
And I think, this is not based on any science, but I feel like us moving towards laminate and hardwood floors has had a massive impact on the health of our dogs.
Yeah.
They're slippy. If you're already feeling a bit sore, you start to tense up. If you think, if you're walking on ice, for example.
Not just ice, muds. I mean, we live in Scotland. It's wet.
So
it's muddy and
you start to tense up.
Yeah.
And if you're already feeling sore and you're tense all the time, imagine being like that in your own house all the time.
Well, this is it. I did choose, because I am always conflicted. I know laminate and stuff isn't the best for dogs, certainly as they age, but even as puppies, skating about in it isn't the best. But then it's so much easier to clean up when you have a multi-pet household.
Yeah.
I couldn't imagine having carpets in my house. That would just I'd forever be doing stuff, cleaning them, and like there'd be stains with some sort of animal thing. But I did choose flooring that had a bit of a groove to it, and a bit, tried to make it a little bit grippy for them.
Yeah.
But then I went all out on my rugs with Eric, and I have to admit, it's amazing watching how happier the others are walking on all these rugs.
Yeah.
And I'm like, should have done that a while ago.
I think it's helpful to go around your house and your garden, if you have one, and think about it from your dog's point of view.
Yeah.
How easy is it to navigate those steps? How easy is it to navigate that floor?
Yeah.
Another big issue is these UPVC doors that have that kind of bit in the middle of the door frame. And often dogs
the bit I trip up.
Yeah.
I always trip on them in and out of people's houses.
So that's you just getting 2 feet over them. Imagine if you've got to get 4 feet over that. And maybe your back end awareness is not that good because of the other issues that you're going on. So your feet that are coming behind, are catching on. So things like that, what can we do to make sure that the house is a nice, safe environment?
I think, just going back to, I'm just thinking as well what you'd said about picky eaters and joint pain.
Yeah.
Maybe having their food in a different location.
Yeah. Raised feeding bowls, mats underneath, so that they're not having to steady themselves whilst they're eating. Yeah. Are definite things that you can do to help them. And there's loads of options now for raised feeding bowls. Raised ones with
lovely
bits on them.
They're really they're proper. It's no longer just that stainless steel tubber.
Yeah.
It can, if you are really fashionable and you want your house to, I've given up on that idea, but other people persevere. I've seen some people's creations. They are stunning. And you wouldn't know that actually that was a raised feeder for a dog.
Yeah.
That just looks part of the furniture. And I think you're right. You put all these things in place, you actually potentially could lower the dosage.
Back to the point I was making half an hour ago.
I know, listen, you go on a tangent, that's more like my kind of, that's like what I do, but well.
Yeah, so you put these things in place and then potentially you can reduce that dose or take them off it completely.
Yeah.
But the issue with arthritis that it is a progressive disease. It is going to get worse.
Yeah.
And so eventually you are going to have to add those pain
things in.
Medicines back in. And potentially polypharmacy as well. So more than one type of medication.
What's to like polypharmacy?
Polypharmacy is not that kind of podcast.
No, I know about poly stuff, but not that one.
Yeah, no. More than one type of medication.
Yeah.
They work in different ways.
Yeah.
And so you might have to combine 2, 3, 4 different types of pain medication in order to get your dog's pain under control.
Yeah.
But, you know, if you're doing regular blood tests, which you ought to be if your dog is on any kind of long-term medication.
You're going to get a heads up.
Definitely.
If anything is happening. I mean, I know by John, he's got rheumatoid arthritis. Mm-hmm. He is on a cocktail of stuff, because that's like an auto.
Just clarify your John's not a dog.
Oh, he's not a John. Oh, he's not a dog. No, he's not a dog. He's a human being.
Yeah.
He puts up with me. But he's in that boat. He has to take, and he has to get blood tests on a regular basis. And he has to have concoctions of stuff, and so it is. It's arthritis is not fun. I have to say.
Definitely. But it's not that things stop working. No. It's that the disease itself is progressing.
Yep.
Yeah.
And it is changing.
Mm-hmm.
Oh, well, I hope we've either enthused people to look at their dogs a bit more with different eyes.
Yeah.
And to see how maybe certain behaviours could be linked with pain, and so we've maybe raised awareness about pain, or we've possibly put you to sleep with this one. Mm-hmm. I'm hoping we've raised awareness and people will be like...
Yeah, but you know, if you do have chronic pain, the importance of a good night's sleep is massive.
Yeah.
So that was another thing I maybe should have mentioned about getting your dog a good bed and making sure that they...
Oh, yeah, exactly. A slightly raised bed, I think, is helpful.
Yeah, there's lots of different orthopaedic options on the market. Just finding what works for your dog. Yeah.
I know, I have to admit, I've tried some beds in the past and my dogs have went, no. And I'm like, do you know how much that costs? And they're like, I don't care. Mm-hmm. It's not comfy enough for me. And I'm like, oh, I'll have it then.
Yeah.
So no.
Yeah, we all know what we're like if we've not had a good night's sleep.
I'm horrible. Quite frankly, I am just horrible. If you get me tired and hangry, I'm just not a nice person to be around. No amount of Halloween gifts would cheer me up at that point. I would be like, no amount of mugs.
Fine. So hopefully we've got people thinking about whether what they're seeing with the dog could be a sign of pain.
Yeah.
And what they could do about it.
And just, being aware that even though I'm saying that pain causes certain behaviours, you still need the training to go hand in hand, because depending on how long the dog is...
You don't want to do yourself out with a job, Becky.
No.
Still need to see your trainer.
Still see your trainer, because they can have created habits.
Yeah.
But unless you address potential medical issues, your training actually won't get you as far as you're hoping.
Yeah.
Because the main cause isn't being addressed. Yeah. Is the main takeaways. Yeah. Well, that was good. I'm excited for September.
Pain Awareness Month.
Exactly. And we'll put in the show notes all the links to what we were talking about.
Arthritis.co.uk, definitely.
It'll be good.
Yeah.
Perfect. Right.
Okay.
Gonna go.
Yeah.
Gotta go now.
Love you. Bye.
Bye. Bye for now.